Hi, my name is Trina Brown, and this is our presentation. We're going to be presenting sickle cell disease. A little information about sickle cell. Sickle cell is an inherited blood disorder that causes the red blood cell to be S-shaped. Hemoglobin is an oxygen-carrying component in a red blood cell. In order to effectively perfuse the body and organs with oxygen, the ideal shape of the cell should be round. The S-shaped cells lack adequate oxygen and also is not as flexible to move freely through small and large vessels like a normal red blood cell. The sickle cell tends to stick to the walls of the vessels, causing a blockage and pain, also called pain crisis. TM is our patient, and he's a 19-year-old male with a medical history of sickle cell anemia. He resides with his mother and two sisters in an apartment. He attends a community college, and he is currently unemployed. TM is compliant with his medical treatment of sickle cell, which includes taking prescribed medications and appearing to his scheduled appointments. TM averages 2 to 3 crises a year. Treatment demands. Treatment at home consists of taking prescribed medications. His medications are hydroxyurea, a medication that lower the chances of having a pain crisis and different diseases that can cause pain, like acute chest syndrome. He also takes folic acid. That helps him stimulate red blood cells, and take methadone for pain management. Drinking plenty of fluids also help with lowering the chances of pain crisis, and wearing appropriate clothing for the weather, and having a balanced diet. Going to the doctor regularly for a blood transfusion may be required because the red blood cell's life cycle is shorter than a normal red blood cycle. When you have sickle cell anemia, the S-shaped cells tend to die in 10 to 20 days, whereas a normal red blood cell blood cycle is usually 120 days. So a lot of times these patients are a little more anemic more often. Treatment at the hospital consists of hydration with normal saline, pain management with intravenous narcotics, a lot of times morphine or Dilaudid, blood transfusions, and comfort measures like oxygen and warm packs to the areas that has pain. This disease process is crucial to those who are affected. The disease is very debilitating to those in a crisis. During a pain crisis, the patient may not be able to meet their activity of daily livings, and will require assistance from family and hospital staff. Depending on different individuals, management of the disease, some patients may be eligible for state disability because of their inability to work and how frequent they are having a pain crisis. That concludes my section of the presentation.